This is Dr. J-Mac, and today I'm going to have on a guest, somebody who I know personally. Her name is Lizzy Savetsky. She's an online digital creator and influencer with an amazing family, but she's here today because she has a story to tell. She's experienced infertility. She's experienced in vitro fertilization. She's experienced ectopic pregnancy. She's experienced miscarriage, and she's experienced placental abruption, all to finally get 3 happy, healthy children. There are a lot of people out there who are experiencing these similar things, but they don't know that they're not alone. So I invite you to join us on her journey so you can see that you're not alone in your struggle. Hey, I'm Dr. J-Mac, and I'm so excited today to have an extremely talented individual. She's also a very successful digital creator and influencer. Her name is Lizzy Savetsky. Lizzy, thanks for joining us today.
Thank you so much for having me, Dr. J-Mac. It's great to see you again.
So good to see you again. Yeah, we knew each other growing up. We used to sing together growing up around Fort Worth, a small town here in Texas. You're just aware of other individuals that just have drive, talent, and are obviously very beautiful like you, Lizzy. And I'm excited to say that I know you.
I may or may not have had a crush on you back in the day. Just saying.
Don't tell my wife, but I may or may not have had a crush on you as well. And moving on, awkward. The reason why I wanted to talk to Lizzy today is that she experienced something that so many people in the world are experiencing on a very regular basis, but because it's so painful and because the emotions run so deep, people don't talk about it. And when they experience these things, they feel like they're completely alone. Can you walk us through the very early days? I mean, because this all started with infertility. Am I right?
Yes. From day one, I struggled to have a baby, and I was 23 when I got married, super young, and I remember my mom telling me, like, growing up, she'd be like, "Well, use protection because we're very fertile." And I remember, like, I always thought that I was pregnant, like, always, like, would go and buy like all the pregnancy tests at all the drugstores. And never in a million years thought that I would be somebody who would struggle with infertility. And so when we had been married for a year, I thought, okay, like, I'll get off birth control and I'll get pregnant. And it just didn't happen, and I wasn't getting my period, and I kept waiting, and I would have probably waited forever because I'm just not. I love to be in denial. I'm not proactive with
Mm,
medical stuff. But thank God I'm married to a doctor who was like, "This isn't normal. We're going to look into this," and he's the
right.
one who actually made the appointment with the reproductive endocrinologist. And I remember just like sitting in the office there, like 25 years old, and thinking, like, what am I doing here? Like, I don't
Right.
belong here.
Well, that's
Um,
because nobody knows how common it is. 15% of couples in the world are infertile. And an infertility, by the way, the medical definition, for those of you who are non-medical, is trying to conceive for a year without using any contraception and being unable to conceive. And that's before the age of 35. After 35, I think because they want to speed things along, it's 6 months. But 15%, that's 1 in every 6.66 couples. So if you have 7 couples in a room, nobody realizes it, but one of them is unable to conceive and maybe getting pressure from their parents and grandparents and friends like, you should have a baby, you should have a baby.
mhm.
And nobody realizes that they've been trying for years and they're
Yeah,
emotionally wrecked because of it.
totally. And for some reason, it's such a taboo topic, and
It
there's so
is.
much shame and guilt around it. Like, I
Right.
felt, even at the age of 25, when we were first trying, like, I definitely felt like there was something wrong with me.
Mm,
And I was the one, my husband wanted to have a child and I couldn't give it to him.
mm,
And I took that on and I carried that burden. Um, and I carried it alone, and it was really hard. I didn't want to share with my parents what I was going through. I didn't really open up to anybody. Nobody knew. Um, and it was extremely dark and lonely for
Mm,
me. And so I was diagnosed with what they call hypothalamic amenorrhea, which is basically like a diagnosis of exclusion. It just means like your brain doesn't tell your body to produce estrogen. They don't know what causes it. There are many causes, um, but they don't, there hasn't been like an exact understanding of it. It
mm-hmm,
can, and then all of a sudden it can like self-correct.
mm.
Um, we'll get to that part later, because here I am 36 years old and it just self-corrected for me.
Oh my
Um,
gosh.
After all these years, like after
You're
going
like,
through
where
everything I
was
went through.
this when I needed it?
I know. I'm like, is God playing a joke on me?
Oh,
This is crazy. But I'm happy that my body's now working. So, it is what it is. And I also feel, and I'll talk about this more as we talk, but I do feel very grateful for the struggle because it allowed me to really be there for other women like me.
mm-hmm.
I was able to really be there for people. So
Mm.
when
Well, it
I,
takes so much courage for you to be able to talk about it in general. The reason why I knew about it is because you were so open about it online and you had made a couple of posts and I was like, I had no idea that she went through all of this. And like we were talking about, one of those things that people feel that one of the reasons why nobody knows how common it is because of that guilt and because of that shame that even though as a guy and as a medical professional, I can say that it's nobody's fault, right? You didn't have any control over what your body was able to do or not to do, but those are just natural feelings that come along with it, and that loneliness, that women
loneliness.
have all around the country to be able to hear from somebody as courageous as you about those emotions and about those struggles, it's so important. And
And
hats off to you for being able to do it.
Thank you. And if you couple that loneliness with the hormones that they put you on to conceive, it
Mm,
is a cocktail for complete disaster.
mm,
And I was not prepared for the emotional toll that it would take on me. I'm very sensitive to hormones. A lot of women are. And I just became a totally different person.
mm.
And there was no like emotional preparation, counseling. You know, Infertility doctors are not therapists. And so I really like reached a very extreme point of depression
Oh yeah, I'm
at one
sure.
point and was like
And your husband's in
going up.
residency at this point, or is he
Yeah,
pre med, or where are we
he
along the
was
track?
in his intern year at
Oh my
NYU,
gosh.
worked
So
for
for those of
surgery.
you watching, Ira Savetsky is an extremely successful, very talented plastic surgeon, and obviously Lizzy was there for that entire ride through all of those hours and hours and hours and sleepless nights that he was at the hospital, and then he comes home and is supposed to be able to emotionally hold you in a good place going through some of the hardest times in your life. And I can't even imagine the strain that it put on your relationship.
It was really like one of the I still can't believe I look back on that time and I can't believe we got through it.
uh,
Like there were nights where like I was just going out all the time because I didn't have an outlet. Like I didn't know how to handle the pain.
mm,
And none of my friends were married with kids, so like because I was young and I so they were all going out, and I remember like he would be getting home from call at like 6 in the morning, and I would like be getting home at the same time as him,
oh my
and
gosh.
he would be like furious. He's like, "What are you doing?" And I was
You
just
think you were
like,
distracting yourself?
I was, yeah, I didn't know how to I didn't know where to put the pain or know how to deal. And
Mm,
I was so lonely. I didn't want to be alone, so I was like out searching for like friend, like I was just
yeah.
trying to keep myself
In New York City, right?
preoccupied.
You're in New York
Yeah,
City, one of the most populated cities on the planet, and you're in all these crowds, but you feel so alone. That's
totally.
yeah.
Exactly. It was a very isolating place to be.
Mm,
New York can be the loneliest place in the world when your head's not
mm,
screwed on right. So,
mm.
and mine definitely wasn't for a long time. Like I got to the point where I really convinced myself I was never going to be pregnant. I went through 6 IUIs, um, which is where like the turkey baster, um, and
The very
um,
expensive turkey baster.
a very expensive turkey but and yeah, and that's the whole other thing is like the money component. It's
Right.
just so much added stress and pressure, and it's like
I mean,
I'm
how much,
married to this resident.
so you did IUI, you did in so with IUI, I'm an emergency medicine doctor, so I'm not as familiar with the ins and out. Is that intrauterine in
Intrauterine insemination.
insemination? That makes sense. Okay. But then you're paying how much money to do that?
Yeah, I
Tens of
think
thousands of dollars, I'm
insurance
sure.
covered like the first two or something. And like for whatever reason, the doctors have this specific protocol. Like if you haven't done X amount of IUIs, they won't
Mm,
do IVF if you're under a certain age.
mm-hmm.
And so even if they think it's not going to work, because the
And you did
chances are much,
clomiphene
much
as
less.
well, I'm assuming?
Um, yeah, Clomid.
Yeah, Clomid, exactly. Yeah,
Yeah, yeah,
so
yeah,
Clomid or clomiphene, those are some of the hormones
yeah.
that you were on that also was kind of throwing you off of your normal kind of balance emotionally
Oh,
and
yeah,
helping you though to ovulate. Um,
exactly.
and Clomid is they've worked out fortunately the dosing a little bit, but kind of early on. Remember in the I think it was like maybe the late 90s where all of a sudden people were having like septuplets and stuff and octuplets, like, 7 and 8 babies in a uterus at the same time. That was because of clomiphene. They hadn't figured out the dosing for it yet, and so
Wow.
women would ovulate too many eggs at the same time, and obviously at that same time, there's a lot of sex going down to try to make a
Yeah,
baby, and
yeah.
so you could
I
end up
actually,
fertilizing 8 eggs at the same time, and if they all implant, man, you got 8 babies in there.
I had a cycle where I hyperstimulated, produced too many
Mm.
eggs, and they made me wait till the next month,
Uh,
because
they
they
didn't want
wouldn't
you to
let
end
me
up with 6.
yeah, not, I mean, I would have, loved to have had one, but,
Right.
I mean, it never worked for me. So,
Mm.
um, you know, it was, and that was frustrating too, because it's like, then now you're super bloated because you're hyperstimulated and you have to wait another month and you can't do anything. So,
And every
it
month that
was just
goes
like,
by, does it just hit you like a ton of bricks? Because I remember, so from my hashtag, first world problems situation with my wife, we had the first 4 months that we were trying, we were unable to conceive, and that is only 4 months,
but
and
it feels
it
like a
was
long time.
it felt like for my wife every month that we weren't successful in conceiving, we started to go through those emotions. What's wrong with us? Is there some, because our whole life we're told, like you said, you're fertile, you're so fertile, like make sure to always use protection. And then people are like, okay, once we take the goalie out, we just gonna have baby after baby after baby. But it doesn't work like that in the real
It
world.
doesn't.
Even if you aren't quote unquote infertile, it still is extremely difficult for human beings to conceive. You always hear the stories about, oh, first try. But in the vast majority of couples, there's a lot of heartache behind that. And there are many, many months of trying behind that conception. And so, from my perspective, that's all I have to personally connect is those 4 months. And for people who struggled for years and years, it's honestly beyond my ability to comprehend.
And I'm sure you as the husband, it's really hard because you feel so helpless. You're like, "Well, I did my best." Like you like,
Right.
you're like, "I did my job," but you can't, there's nothing you can do. It's so out of your
And then
hands,
it
and you're
feels like a
watching your
job at
wife.
one point too, right? Your
Yes,
whole life you're like,
totally.
sex is always going to be fun. And then, but when there's like the emotions of frustration and
Yeah.
guilt, like you said, so it,
It takes
it
the fun
takes all
out of
the
it.
fun out of it. It takes all the fun
Yeah.
out of it.
Yeah,
And you're
and
like,
it
oh,
shouldn't be like
look at
that.
the schedule. Today's the day we're supposed to do it. And you're like,
I know.
like put on some Marvin Gaye maybe, and let's make
Yeah,
this
you're like, I guess I'll shower.
sexy.
Um,
Yeah.
yeah, no, totally. And yeah, I mean, I think if there were a few IUI appointments where Ira wasn't even there. I'm like, I remember, this is disgusting, but I'm going to share it because this is the reality of it. Like,
Yeah.
because of his schedule, his residency schedule, like, he couldn't get there. So, like, he would wake up in the morning, jack off in a cup. I would have to bring the cup of
Oh,
jizz to the plate, like, and like, this is, I'm like, we may have just
that's
like
just real.
conceived our child and you weren't there.
Yeah,
And
and
I mean,
that's
it was
that's the
like,
memory that you could get.
yeah, like
Mm,
this is not like a fun period of life at all.
mm.
And like but what it's worth everything. You would do anything to have a child when you're that desperate for it. Like there is this like animal instinct that you just like you're not going to give up and you're going to do whatever it
Well, but Lizzie,
takes.
so many people do give up. So many people do give up, and that's why I mean, I have so much respect for you for a lot of reasons. But as everybody continues to follow along with this story, everyone will have the same level of awe for you. I think because it didn't stop here; it kept going. You then went to in vitro fertilization, which is a whole nother level of financial, physical, and emotional stress.
By the time that we got to IVF after the six failed IUIs, I was ready to try something else. Um, I was very emotional about it. I remember being extremely overwhelmed. I went to the class. Um, it was a very bad day. I remember it like it was yesterday. I went to my friend's bris, which, for those of you who aren't familiar, on the eighth day of a Jewish baby boy's life, they have a circumcision, and it's like a big celebration where the baby is now Jewish. So my friend had just had a baby. I didn't want to go to the bris because I knew I was going to be an emotional wreck after all this infertility experience. But I went and I was crying the whole time. I ended up leaving
Mm.
in
And you're
tears.
supposed
And
to be
then,
happy for your friend and happy for this innocent little baby, but you can't
yeah,
help feeling resentment, right? I mean, I can't
you
put my
can't.
emotions on you, but I would think that you'd be
Yeah. And then you feel
frustrated,
guilty
but
for feeling
yeah,
resentment.
you're like I
It's
resent this
like
8 day old
layer on
baby.
top of
Like, what's
layer.
wrong with me? I'm a monster. But those are just those normal emotions that that again you feel
Yeah.
guilty for having. I'm sure.
And when you're trying to get pregnant, everyone is having babies. Everyone is pregnant. Like everyone, every
Mm,
time I would go to the synagogue, somebody else is pregnant. Somebody else just had a baby. The grocery store, like everyone. So it's all around you all the time. You can't avoid it unless you're just going to hide out in your house, which you can't really do. So yeah, so I went from that experience that morning to my IVF class where they're showing me, with an orange, how to stab myself in the ass with a needle because my husband's going to be, at the hospital. So I'm going to have to give these shots to myself. I hate needles. So I'm like digesting all of this. I just remember that day so vividly, like crying all day long and, accepting that this was going to be my reality and like thinking that none of these IUIs worked. So why is this IVF situation going to work? Of course, I'm going to try it to feel like I've tried everything. But I did not feel hopeful. I wasn't like somebody that's like, it's going to happen for me. I just knew that like I had to keep trying, but I could not visualize like Oprah and her vision boards, like I couldn't see myself pregnant. Like I just couldn't imagine it
mm.
because I had not been able to, my body hadn't been able to do it.
And at this point, are you opening up
Um,
to your friends and your family about the struggle that you're going through? Or are you still keeping it all
no,
inside?
I had two friends that I talked to, one of whom had a miscarriage, and then another one who had gotten pregnant via IUI. And they were not close friends before this experience, but they really held my hand through it. And other than that, nobody knew. I was going to work every day.
Mm.
Yeah, I'd go to the doctor to get my blood taken, fertility doctor on my way to work, and then go to work. And then, it was nobody in my life knew.
Mm.
And I didn't want to talk about it for some reason. I guess there's something in us that maybe the fear of that vulnerability of
Yeah.
opening up, maybe then it makes it even more real.
Real.
Or
Mm.
maybe once you start crying, then you won't be able to stop
Right.
if I didn't know if I would be able to like go there.
Right.
um
And also,
And
yeah,
then,
you're facing the fact that there is something wrong with you, right?
yeah,
But it's
yeah.
again, 15% of the entire world's couples are unable to
And yeah,
conceive.
and
15%.
which
But nobody knows
that's
that.
wild.
Nobody knows that because nobody talks about it because it's just so freaking painful.
That statistic is crazy
It blows
because
my mind too.
you hear so little. You hear so little.
Right.
But I was very lucky because my the first time I did IVF, we did a fresh cycle, which means that they in the same cycle they stimulate you, you get the eggs, they fertilize them, and then 3 or 5 days later, they put the fertilized embryo in you. And so nowadays, most doctors will do what's called a frozen cycle, where they'll wait at least a month in between to let your whole reproductive system, I
Mm.
guess, kind of rest, and then they do it.
But they got
But
right up
for
in there.
me, yeah, for me, I really just wanted to get it done.
Mm-hmm.
I wanted to be on the hormones at for as short of a period as possible. And because of my age, they said that genetic testing the embryos at that point wasn't necessary. I think nowadays most places will genetic test regardless. Um, but we did a fresh cycle and it worked. And I'll never forget the moment I was at work and I was sweating all day. Like I was waiting on the call and I remember I got the call, I was in the bathroom and they said, "Congratulations, you're pregnant." Um,
And this is the
and
first
I was
try
so
with IVF.
yeah, with IVF.
Boom,
And I
baby.
couldn't believe it. I couldn't believe it. But you don't trust it because after everything you've
Right.
been through, you don't believe that um that it's really going to happen, that this positive pregnancy test is going to turn into a baby.
Mm-hmm.
I mean, and it's a long road ahead of you. So,
And did it?
but I was very blessed. Yeah, thank God. Stella, my oldest
All
daughter,
right.
yeah, it was great. I was very lucky. It was a pretty uncomplicated pregnancy. Until the end, she was growth restricted, so she was very, very small, and they had to induce me. But thank God she was healthy and perfect, and um, yeah. And so after that, we were like, okay, we know we want more than one
Right.
baby. So I was like, we had a lot of trouble. It took us a long time to conceive. Like we had one embryo frozen, just one. And I was like, let's just like put it
Let's
in
go
and
again,
see
baby. Round
because
two.
yeah, I was like, let's go. And so Stella was less than a year old. I mean, I'm crazy. I think about it now, like that's
That is
ridiculous.
totally ridiculous.
I don't know what I was thinking. I guess like I thought, well, it could take a while, so let's just do it. And so we put in the frozen embryo less than a year later, and that is Juliet and my younger
Success story
daughter.
number two.
So it was like literally like boom, boom. And it was not a big deal doing the frozen cycle. Like, and comparatively, like going through everything that I had gone through with trying for a year and not getting pregnant, and then the 6 IUIs, and then the retrieval.
Mm-hmm.
So to just do a frozen transfer was like nothing. I was like, oh, this is like small,
You got this.
potatoes. This is
Yeah.
nothing. And so I was very naive after that.
Mm.
I was like, okay, like I want to get a baby. I just do IVF and it works.
Yeah,
Like
and
I
it's going
get
to be
pregnant
just
via IVF.
boom, like that. No problems.
Yeah,
Easy
I got
sailing
cocky.
through pregnancy, have that baby. All is good. So, how
Exactly.
long after? So, forgive me. So, it's Stella and
hmm Juliet.
Juliet. So, Stella and Juliet are born. You're raising two children that are essentially, well, like a year and a half apart. How many months apart?
Yeah, they're 19 months apart.
19 months apart. That's how far apart our two children are. And this is while Ira's in residency.
Oh yeah.
You and my
And
wife
I'm in New
can share
York.
some stories because she would always it would hurt my heart to hear, honestly, because she'd call herself a single parent, and that like I always wanted to be a good dad and always be present, But when you're in residency, I mean, it's not your choice. You don't choose to be gone all the time, but you are. I mean, you're doing it for your family and you're doing it for yourself, but you're also, I mean, you have the guilt as the husband and the father of feeling like you're abandoning your family, you know?
Yeah,
And so I struggle with that a little
was
bit, but
I was so hard on Ira, and
mm,
like I look back and I was like so not nice, and
mm.
and it was
But your feelings
because
are totally justified.
I didn't have anywhere to put my pain,
Right.
other than like towards him
Hmm.
because it was his career.
Yeah.
But he felt the exact same way as you. Like he's like, "Do you think I want to be here?" He's like,
Right.
"Of course I'd rather be with you." He's like, "It's not like I'm out like at the strip club
Right.
or,
Yeah.
in
Yeah.
Vegas or something and he's right. Like he never went on any bachelor parties or he never did anything
Well, I
social.
did
Like
those
he
things.
literally went he literally
I did.
like went to work and then like was home. I
Yeah.
mean, there was just no time. Like
Right.
he had no there was literally not an extra moment for anything extracurricular and like I was alone in the synagogue like on the Jewish holidays like
Mm.
everyone just saw me as like and
Do you
people
feel like
pitied
pity? I
me,
was just gonna say that Rebecca still talks about that. She's like, I feel like people pity me sometimes, and
yeah.
I'm like, I don't know what to do about that. I mean, there are great things that come out of having a doctor as a husband, and there are terrible things about it. And we're still my schedule
There's a
still
trade-off
is
with everything.
there's a trade off with everything. Well, my schedule's still terrible. I mean, I work overnights and weekends and mornings and middays and stuff, and I might be able to pull back a little bit here doing all this digital creator stuff online, but until then, I really, I'm at a residency, but I still don't have the best schedule. But I have,
Well, ER is brutal because it shifts.
yeah, it's brutal and awesome all at the same time because when I'm off shift, I'm totally off shift. Like right now, like I'm
Yeah,
here
you're
with
not on
you.
call ever.
Nobody,
Yeah.
yeah, nobody's going to call me and ask me for help or a prescription or a pre-authorization or this or that. Or when I'm done, I'm done. And so, in some ways,
There's no
it's a really great
surprises.
job. Yeah, there's no surprises. My life is very schedulable, but my shifts still really suck. But
Right.
that
It's just a
pity.
long
Mm-hmm.
road. It's like, yeah,
Mm-hmm.
there's no like, yeah. And I mean, I think honestly, like, I don't know what I would do if I had like a normal 9 to 5 job because I've become so independent
Yeah.
and like I'm so grateful for that,
Mm-hmm.
and I felt like honestly like those days in New York where it was like me and the two girls, it was like us against the world. Like I
Mm,
have so many good memories of like taking them out to dinner in our
mm.
pajamas and it was like our little like girls
I
club.
bet you're such a
Like
good
I loved
mom.
it. I mean, I definitely have my shortcomings, but they will tell you like I'm the fun one. I'm the fun
Yeah.
parent.
Dinner and
Because
PJs. That sounds fun. I want to do that.
we had to we had to make our own fun, and I was like I could mope around. And I had this aha moment in a therapist's office. He was like, "Lizzy, like you need to get rid of your expectations that Ira is it's Ira's job to make you happy." He's like,
Mm,
"The only person in charge of your happiness is
is you.
you."
Mm,
And I was like, "Okay, so I need to figure out what's going to make me happy and then do that."
mm.
And like that, and it was like, okay, like once I was able to let go of needing him to be that service for me, then it really was like a new moment for me. And especially like going through the next chapter, which I'm sure we're going to talk about
Right.
now, which was really, really challenging.
So you have Stella, you have Juliet, you're, you know, single parent essentially in New York City by yourself, as much as it hurts for Ira to hear that. You're essentially single parent in New York City. At what point do you guys decide, okay, it's time for a third and it's going to be so easy and we're just going to knock it out?
So I knew that I wanted a third. Um, and knew that like I had 100% success rate with IVF
Yeah.
with my two kids.
It's going to be easy
So
peasy.
I was like, I need to wait until I'm ready because like I had my hands full. And so I waited until um, I think what happened was Juliet was started school and I was like, okay. So I had to do another retrieval. And so I did that. And at that point, they had switched the protocol. So you couldn't do a fresh cycle anymore at the practice I was at. They would only do frozen cycles and they would only genetic test the embryos. So they genetic tested them. They asked us if we wanted to know the gender. And so we said yes. And we had two girls and a boy.
Mm.
And so I remember, and then we put them in the freezer, and we were like,
And
okay,
are you
we'll
guys
wait a couple months.
Ashkenazi, by the way?
We are,
Yeah, just
yes,
curious
we're
because there
Ashkenazi.
are a lot of genetic
Genetic
issues. Yeah, as I was
diseases.
going through med school, it was like, oh, you only
Yeah,
have to worry about this if you're Ashkenazi. And I'm like, gosh, those poor
yeah. We have a lot
Ashkenazis.
of inbred diseases. Yeah, and
Yeah.
Ira is actually a carrier
Oh.
for one of them. So, yeah, and like there's also genes we don't know about. Like there's cancer in both our families,
Mm.
but but like lots of Ashkenazi stuff, I guess,
Mm-hmm.
just because for over the too many years of marrying cousins, I don't know.
Yeah.
But we so we decided to freeze them and sit on it for a little bit, and then I was going through a hard time in my life. My uncle passed away very suddenly, my
Mm.
dad's brother, and I just didn't feel emotionally equipped to do the transfer.
Mm.
And so we waited, and about a year later, I was like, "Come on, like it's time now." And I just didn't feel ready. But I had found out that I had osteoporosis because of my low estrogen
Mm-hmm.
level. And so they wanted to put me on hormone replacement therapy, and you can't do that if you're trying to get pregnant. And so I was like, all right, I guess I'm never going to feel ready. Let's just do it.
Okay.
Like I knew I wanted a third kid. Juliet at this point was like three and a half. So I was like, all right, let's pop in an embryo. And so we did, we put in the boy because we had
Oh
two
yeah, here
girls.
we go.
And I was like, and I for sure thought it was going to work. And I did get pregnant. I never in a million years would have imagined that it wouldn't be a healthy pregnancy because
Right.
my other two had been. Like I had done this before. And I did the same thing, I ate pineapple after the transfer. That's what you're supposed
That's
to
what you're
do. It's like
supposed
an
to
old wives'
do.
tale.
Yeah, the trick for Rebecca and I getting pregnant was eating a peanut butter and jelly sandwich and laying upside down with your feet up on the headboard for 30 minutes. Like that's just how you get
Does it
pregnant.
work?
Yeah, oh, it works 100% of the time. It's so
Yeah.
silly, but they just, you end up with these superstitions and you're like, I know this is ridiculous, but I'm going to do it. Like what's the harm in eating a pineapple
Why
right
not?
afterwards? It worked
I
the
ate the
other times.
pineapple.
Yeah.
I'm like, I ate the pineapple. Like, I don't understand. Like, okay. So, so yeah, so like I was going in for my blood work, like everything was good. And then they did the first ultrasound and there was nothing in my uterus. But
Mm.
my hormone levels were still rising,
Oh.
the pregnancy hormone. So that's when they realized it was ectopic.
Mm.
And I was lucky that that they knew what was going on
Right. And
and
then
they were able
for
to
those
give
of you
me.
who are non-medical watching this or are unaware, an ectopic pregnancy is when the embryo has implanted somewhere other than inside the uterus. So it can implant in the fallopian tubes themselves. They can implant on the intestines. They can implant on the outside of the uterus. There have even been these crazy cases of the embryo implanting in the liver. And
I just heard
anytime,
about
isn't
that.
that crazy? And that is so life threatening. I mean, it's life threatening when it's just in the tube itself. Um,
Anything near my liver is life threatening.
we need that liver. We got to get our drink on. But the embryo itself developing in an area that does not have the infrastructure, the capability of stretching and expanding, while at the same time having a lot of vascularity. That is, all these blood vessels are developing, and it basically is a ticking time bomb for what's called an ectopic rupture, where a person bleeds out into their abdomen and they have no idea that they're bleeding to death. And we'll see these in the emergency department. These are the sickest people that I've ever seen in my life, the closest to death that I've ever seen. Women in particular will be, during these ectopic ruptures, and their blood pressure is extremely low and their heart rate's extremely high. and they maybe have some vaginal bleeding or some abdominal pain, but the only thing you need essentially is an ultrasound to look inside and see a ton of essentially fluid inside the abdomen and a positive pregnancy test, and you go right to the operating room because your life is in extreme danger. So where along the way did they end up identifying this? This is far
So
before a rupture or anything like that,
yes,
correct?
I was very lucky that, this is an IVF. But I was like so confused. I'm like, I did IVF. You put the embryo in my uterus.
Yeah,
How is it now in my fallopian tube? Like,
right.
I don't understand.
Mm-hmm.
Like, that doesn't make any sense. And they're like, oh, it happens. And
Mm,
like, okay. So, I was lucky. They gave me what's called
right.
methotrexate, um, which maybe you can explain better than I can what that
Well,
does.
people call it a chemical abortion. Obviously, it's
Yes.
not an abortion in the way that people think about abortions, but it's a way to terminate the pregnancy chemically, because again,
It stops all of your cells from dividing.
correct. Hmm.
I know because like I lost hair. Um, I felt very
It's
ill
basically a
for about
chemo. It's
a few
basically a
days.
chemo treatment.
Yeah,
You basically got chemotherapy to stop your baby from continuing to grow, and that, it sounds kind of barbaric, but again, if that baby is allowed to, if that embryo is allowed to continue to grow, that'll kill mom. And if mama's dead,
yeah.
baby can't survive.
There's no, but yeah, and a lot of people said some really dumb things to me during that. Why can't they just move it from
Yes.
your fallopian tube to your uterus? Or
Sounds
I
so
can't believe
simple.
you would kill your baby, or
Yes.
think. And
You
it's
got
like,
that? Who's
okay,
were these like your friends
well.
or people online or something?
Well, so no, so here's the thing. When I was recovering from the ectopic, I was supposed to go to Fort Worth to visit my parents. Uh, and I thought I was pregnant, so I was like, all right, whatever, like everything's good. And then they didn't want me to travel after I had the methotrexate. They needed to make sure it worked, whatever. And so my mom came and got the girls and took them so that I could recover.
Mm.
And I went and I was sitting alone at home, and I was like, you know what? Like I have gone through infertility and now pregnancy loss, all like I've gone through all of this, and nobody out there knows. I share so much of my life online. I share so much of the good, and I'm like, this feels so inauthentic.
Mm.
Um, and it's not to say that like everyone needs to go public. But for me, I felt like I needed to be true to myself,
Mm.
and share with my audience that, life isn't perfect. I'm struggling right now,
And so many other
and
people are. People are
so
probably
many.
watching this right now that have gone through the exact same struggles as you, or to a similar degree. And
Yeah, 1 in 4 pregnancies ends in loss. That's a huge
maybe
number.
more, maybe even more. That's just that those are proven pregnancies. There's so many times where you've lost, the pregnancy, and it's just too early to even detect. So it's maybe even more than
Right.
that.
Yeah. And so, I felt sort of like impulsive for sure. Ira was in the OR when I decided I was going to share on Instagram
Mm.
that I was going through this. And so I didn't want to wait for him to get out because I knew that I would like lose my nerve. And so I was like, I'm just gonna do it. And so I went on my Instagram stories, and I was like, I'm going through a really hard time right now. This is when Instagram was like super curated. We're talking 2017. This like people were not sharing their problems. They were not crying on
It's just
Instagram
beautiful
stories.
pictures, high fashion, you know, looking
Yes.
natural. You're a pro at this, by the way. Just looking like totally natural, but obviously, like done up in a wonderful way, and you got your Gucci bag and this and that. And so that's essentially like all Instagram is pictures like that. And then you're taking
Yeah.
it to this very real, authentic, vulnerable place.
Yeah, they're like, this isn't an avocado toast. What's going on here? So, um, so yeah, I was like, I'm going through this really hard time. I was pregnant, and I just found out, that it's ectopic, and I just wanted to like come on here and share because I was like, I know the statistics say that this happens to a lot of
Mm.
people, but I feel like I'm the first one in the
That's
world
because
that this
nobody
has
talks
ever
about it.
happened to.
Hmm.
And immediately like my inbox was flooded with people. And it was like people sharing their stories with
Hmm.
me, people being there for me, people praying for me. It was wild.
Mm.
I was like, whoa, okay. And Ira came out of the OR and he was like, Lizzy, what did you do? Like, why is my phone blowing up? Because we hadn't even told our families
Mm.
that like what we were going through. And so everyone was like, what? Lizzy was pregnant? Um, but I felt like it was the best decision I ever made,
Mm.
because um, it transformed my plot. I didn't know in that moment that I was changing the course of my whole
Oh,
career,
wow.
um, because it was the first time that I had ever realized the real impact my platform could have.
Right.
Like that it wasn't just about selling clothes, that it was like, oh, like I can make a difference here.
Mm. And you do.
I can I can use my voice for,
Hmm.
you know, for the greater good. And so yeah, it was really like the beginning for me. And so it was a gift in a way,
Mm.
in a lot of ways. And so we waited a few months, and then we put in the another embryo. And I remember we had booked a trip for Passover, and my mom was like, "You shouldn't." She's like, "We can't go away for Passover. If you're doing IV." She's like, "You should wait to do IVF till after." She's like, "Remember what happened last time?" And I'm like, "You can't have two ectopic pregnancies, Mom. Like that just can't
Oh,
happen.
my God.
Like that would be like winning the lottery twice." Well, I wish that I would have knocked on wood because I wish it was the lottery. So we did it, and I, lo and behold, ended up with the second ectopic
God.
pregnancy
But they
in
caught
the
it
same
early.
tube.
Yes.
They caught it early, but unfortunately, my body did not respond to the methotrexate,
Oh.
and I didn't listen to my doctor and went to Arizona for Passover
Mm.
anyway, and um, got my blood work done there. Hormone levels were still rising. They had to call in methotrexate to the pharmacy there. Ira gave it to me. Um, and it didn't work again the
Mm.
second time. And I guess like my doctor, I don't know what the reasoning for this was because I don't think it's common, um, but after the second time, they decided to give me a third round of methotrexate. Maybe they thought Ira didn't like
Do
administer
it
it
right. Yeah.
properly, or I don't know. The doctor was so upset with me for leaving because it's like you were saying, it's a life-threatening
Hmm.
situation. Like, I could have easily gotten stuck at a hospital in Arizona. Like, and I would have been lucky to have had that,
Right.
like what if I had been like in the air and it had rubbed, I mean,
Totally.
it was just it's not responsible to travel. And I shouldn't have. And it was a terrible trip.
But at the same
Um,
time, I mean, you're not only thinking about yourself, you're thinking about your kids. You want to create these memories for your family. You're like, we can do this. We can will
yeah.
ourselves through it. And then here you are in
Yeah.
Arizona, failed methotrexate times three, baby's still growing in
Yeah.
the wrong place.
In the wrong place. And um the, I also um I didn't understand this at the time, but it would be important for people to maybe know this detail that once you've had one ectopic pregnancy,
Hmm.
your chances are higher
Yes.
for having another one
Yes.
because there's scar tissue there.
Right.
Um, and so I wasn't aware of that. And so I was shocked when I found out that could have a back to back ectopic.
Right. Because in your brain,
And some
again, you're
people
like,
have,
oh, that super rare thing happened. What are the chances of that happening again? But yeah, the general public
yeah,
doesn't
I'm like,
know that actually you do have a higher risk of that happening again.
and I remember even saying, joking with my doctor, like on the table, I'm like, make sure it's in my uterus, like, and he's like, I'm putting it in there, and I like was watching on the screen as
You're
the
like, there it
embryo is
is,
in my
going into
uterus.
the uterus. We're not going to have any problems this time. Oh.
Yeah, and so anyway, we got back, had the third round of methotrexate. I was trying to distract myself, so we went to see Frozen on Broadway with the girls. I'm at Frozen on Broadway. I start having crazy abdominal pain. Go to
Mm,
the bathroom. I'm bleeding.
mm,
And so we went straight to the ER at Mount Sinai Hospital. And it's like you were saying, I was chills, sweats, had a fever. Um, and I was lucky that I knew what was wrong with me,
mm-hmm.
that I had done IVF, that I had an ectopic pregnancy. I knew the likelihood was that it had ruptured.
Right.
Um, I'm lucky I didn't die in the ER at Mount Sinai because it is not like the ER. It was a terrible
Oh
experience.
no.
I did not feel advocated for. I was with my kids, so Ira was in the waiting room with them. I didn't want them to see me like that.
Right.
I was alone in the emergency room, very traumatic hours, bleeding and like in and out of
You were passing out?
like yeah, I was just
That
like,
is so
it was the
concerning.
trauma. It was definitely the trauma, like that was, and I have a tendency to vasovagal when I
Right.
get
Right.
really worked up.
But you're
Um,
also probably losing a
but
lot
they've,
of blood, and so physiologically you may have been passing out as well. So to kind of mix it all in together, and yeah, we can't
yeah,
just blame all of that on emotions. I mean, you had a very, very serious condition.
yeah, it was very, very painful. And like they couldn't, I remember they like finally located some archaic ultrasound machine and like they saw that there was a lot of fluid in my
That's
abdomen
blood.
and,
You were
um,
bleeding out into your abdomen. Oh, that's so
yeah.
terrifying.
And so, and I was really angry because I felt like why I did IVF, like they knew I had an ectopic pregnancy, like why did this happen to me?
Hmm.
Like why did it get this far? But I get it. Like they don't want to do surgery unless they
Right.
have to. And
Right.
like they're hopeful that the methotrexate is going to work. Um, but I was pissed, I felt like
Sure.
I was going through all the why me in my head. It was um I don't feel like it was anyone's fault, but I was just like wanting to, I guess, like have answers,
Right.
and that I couldn't, and there weren't any.
Right.
And so, but my doctor did come in. He wasn't on call. He came in and he did the surgery to remove my tube. Um, and that was, I mean, it was
Wait, your
traumatic.
doctor? Now I'm
Like,
confused. Wait, you're not in Arizona anymore. You're back home.
I'm sorry. Yeah, we
Okay,
got
okay.
back home.
Okay.
Yeah, I had
So
the
it was
third
your
round of
doctor at least. Good.
methotrexate.
Finally. Okay, good.
Yeah. Yeah, yeah,
He had
yeah.
the
I
third
had the
round at
third
home. Okay, got
round
it.
of yeah, in
With
New
you now.
York.
With you now.
Sorry,
No, it's okay.
the way I told it was confusing.
Oh,
So yes, so I was in New York at
okay.
Mount Sinai,
So at
and had the
least
surgery.
you have a familiar physician. You're not in Arizona, getting okay. I'm with you now.
No.
I'm back on the same page.
Yeah, and it was the whole experience was for sure the most traumatic experience of my life. Like my kids were there. And so it was not exactly, and like, so I'm worried about them, but I'm like there, in
Fighting for
this
your life.
life-threatening situation.
Yeah, you're fighting for your life.
And like there was my husband like was in the waiting room. I was alone. So it was pretty awful. And then like I remember like feeling like I could die. Um, and like who's going to be there for my kids?
Mm.
I had all these thoughts going through my head. And it's things that I'm still to this day like processing. I'm like, I put myself through like a near death experience to try to have a third child. Like, what am I doing?
When you have two
You
healthy
know?
ones, is what you're saying.
Exactly.
Mm. But that maternal
Yeah.
drive, I mean, you just knew it. You knew you had one more. I'm still talking to my wife right now. We talk about a fourth, and I'm like, honey, we're so old. We're so old. How are we going to be able to
You're
do
not
this?
old, J
I am
Mac.
so old. Don't let the swoop fool you. Just because my hair
You're not,
sticks
you have
up.
a great hairline.
Thank you. But there's
Yeah.
a certain undeniable drive in women to continue having babies, and I know, in that moment, of course your emotions are valid, but it's hard for me to fully understand them because that's your job as a woman. Your job is to keep making these babies and bring them into the world and nourish them and love them. And I know there's got to be some sort of like conflict of interest in your mind though, because you're like, we already made these two. Like, I just need to love and
Yeah.
cherish these two, and why aren't they enough? And yeah.
Yeah, and I think one of the topics that isn't really touched upon a lot is secondary infertility, which is when you already
Mm.
have children,
Hmm.
but you're not able to conceive more on your own, or you're having, and so that for me, there's a lot of guilt that comes with that, because you're like, I'm so blessed. Why do I need more, more, more?
Well, I'm sure there are a lot of
But you're
people
right, like,
watching this right now who've experienced that, because as we push off, our childbearing years until later and later in life, as it is just more and more and more common in America to do so, then people, without realizing it, are making their ability to conceive less likely, and increasing the risk of having many complications with it. And so when you start having babies, when you're 32 and 33 years old, as many people are doing in America, that only gives you a couple of years before you're quote unquote advanced maternal age. Because right now, you're advanced
yeah,
maternal age at 35 years old, and people don't realize that. They're like, I have my whole life to
geriatric
have baby.
pregnancy.
Geriatric pregnant. What a terrible term. You're like, hang
I
on,
know.
I'm not 65 years old.
Geriatric?
Yeah.
I know. I know. It's horrible, but it's true. And yeah, it is more and more common that people are having
Hmm.
secondary infertility. And um, yeah, and at that point, I felt like, okay, we have one more embryo, whatever. Like, I'll try. I went to like a ton of therapy. I had initially been like, I'm done, never again. And then I went to a ton of therapy, got myself all geared up. We did because I was having like a lot of PTSD from the trauma of the rupture. And so we did where I don't remember what it's called, but it's like where you like actually go through the action. Like we did a walkthrough of like what it was going to be like to do the transfer.
Really?
Like where like yeah, because I was like nervous that lying down on the table, I was going to have a panic
Oh
attack and
my
I wasn't going to be
gosh.
able to
So you were
and
doing, so
so
you
yeah,
you did this in therapy? You did essentially like cognitive
yeah,
behavioral therapy, I think is what that would be
we
called.
did.
Yeah.
Exactly. Yeah. I went with like the therapist and we did like a walkthrough of me
Mm,
like changing into the gown and
right.
like everything,
So like
because
in
I
like
was
other
really
cognitive
nervous.
behavioral therapy scenarios, somebody who's like terribly afraid of flying may go to a plane that is actually not going to take off, and they're allowed to like get on the plane and like pretend put their luggage above and close it and sit down
Yep.
and put their seatbelt on, just to expose themselves to that terrifying stimulus without having any negative consequences. So
Right.
that is so cool that you were able to find
Yeah.
somebody to help you kind of through that, through those kind of terrifying emotions, kind of,
Oh yeah.
getting you into the right
And
headspace to do this again.
yeah, I worked a lot on my fears, and I did things differently. I stayed in a hotel the night of the transfer so that I could have some like quiet time, and um you know, I, I did the best I could. It was still very traumatic,
Mm.
even with all of that preparation. Um, and
Did you eat the pineapple afterward?
I did,
Okay.
and I did get a positive pregnancy test. Um, but I ended up having an early miscarriage, meaning like I guess like there was no, there, I don't know. I guess there like after the first ultrasound, there was no longer anything in the
Mm.
uterus. So I didn't have to have any like DNC or anything like that,
Mm.
but
Okay.
it was just like that emotional roller coaster. And for me at that point, I was done. I was like I don't know why God put me on this path. Maybe to help people, maybe to open up. Um, but like I just want to like live my because I so much I wasn't able to like let go of that and live, and I just wanted to live. Like I just wanted to be there for my kids. I wanted to get on with my life.
Mm-hmm.
And so So yeah, so I made that decision, and of course the story doesn't end there. We ended up moving to Dallas because Ira wanted to do a fellowship here, which brought me back home. You know, it's funny, my New York husband brought me back to Texas. So I didn't
So was
really
it
want to
just
come,
the
but
right
I did.
job offer, or what was it exactly that pulled you guys here to
He
Dallas?
so he is very passionate about aesthetic facial
Mm-hmm.
plastics, like nose jobs, facelifts, and the top rhinoplasty guy
Mm,
basically in the world is here.
mm.
And so he wanted to do a fellowship and train under him. And I was sort of like, okay, it's a year. How can I tell him no? Um, and so we ended up coming. And when we got here, Ira and I went to brunch, just the two of us on a Sunday, and I remember he like liquored me up. He's like, Lizzy, he's like, you're out of New York now. Like, your life is so much calmer. Like, I know, he's like, I know you're done. He's like, do this for me. He's like, for me,
Ooh.
just like one more time. And I'm like, how do I tell the guy no? Like,
Mm.
and I had said no, and then I told him, I was like,
Is he one of those
I'll
guys that
do this
doesn't
for
ask
you.
for much, but when he does,
Never
you're like,
ask for anything.
I gotta do this.
Like I think it may have been the first time he ever asked me for anything in our whole
Wow.
relationship.
And so how do you say no, but how do you say yes with all of the heartache, the physical and emotional trauma you've experienced? I mean, I don't think a lot
It
of
was
people would have said yes.
I said I would go to the appointment, you know,
Mm,
to the fertility doctor. And I went and I remember I just cried in the office. I didn't
mm.
want to do it. And then I told the doctor, I said, "If will you let me do a fresh cycle? Because I don't want to be on hormones like one day longer than I have to." And he said, I normally don't do that, but because you're under 35, at this point, I was 34 and a half. He said, because you're under 35, I'll let you do it. I
Mm.
was like, okay. So I was
Barely.
trying to like I was like, all right, can I like do that? Can I have, I think the whole cycle is like 3 weeks if it's fresh. So I was like, can I subject myself to like this for 3 weeks? Um, and I asked him, I said, can I go on Zoloft? I had never taken
And
antidepressants
you're
or
like,
anything.
Mama needs something a
Um,
little extra to get through this one.
yeah, and he was like, yeah, and he prescribed it, and I like Ira was on board for that, and I was like, all right, if I do this, and like, and it actually did help. Um, like I didn't know. I was like, oh, these pills work. That's why people take them. Like,
That's
like all of
awesome.
a sudden I didn't feel edgy. And yeah, and I remember like I was like I was basically just like crossing days off a calendar, like when
Mm.
I was doing the shots and everything. Like, okay, like I was trying not to think too far ahead. I was like, I'm just getting it through it
One
one
day at a
day
time.
at a time.
Mm.
And and I convinced myself I was doing fine. And then in the 2 week wait, I broke out in the worst hives that like you've ever seen in your life. Um, and like I think it was the day after I had gotten a positive pregnancy test. Apparently, I have a very good track record of getting positive pregnancy tests from IVF, 100% of the time. So
That
this is my sixth round.
is amazing.
And I had had six positive pregnancy tests. So
Gosh.
I was pregnant
In six
and
times, I mean, obviously, this is not all about money, but we're in America. This is the most expensive place in the world that you could be
crazy.
having these procedures. And what is it? Is it $10,000, $20,000 per
Yeah.
round?
I think it was
And
15.
does insurance cover
Um,
any of this?
the insurance did cover all of my cycles up until this.
Good,
And
good.
um, my in-laws, I didn't want to tell my parents that I was doing IVF. They didn't know. Because after everything I'd been through and watching me like almost die, they would not have been on board.
Mm.
And I didn't want this added stress of them worrying. And so we didn't tell them. We
Your
did tell
parents
my
are awesome, by the
in-laws.
way.
And
Shout out to your parents. I would just always see them around town and they're just always having fun. You know, they're just
well,
together.
they love you too.
Oh man. Well, I look up to them. I genuinely look up to them in many ways. So that's cool to hear that it goes both ways.
That definitely goes both ways. They're
Mm,
big fans of yours.
mm.
Um, and yeah, I remember sitting with my dad at the Johnny High audition when we saw you
Yeah.
audition. And he's like, "Is that J Max Slaughter? He sings country music." Um, anyway,
I'm just trying to be like
so
you. I'm just trying to have amazing pipes like you.
yeah,
One day
yeah,
we're gonna do a duet.
we have to. I would love that. Yeah, so my in-laws paid for this, which is so generous.
Mm,
And Ira has never asked them for anything, so that he was really humbling himself, like to ask me to do
mm-hmm.
this, to ask his parents. It was a lot for
But
him to
he's
have
dead
to.
set. And this is all. This is not just for the third baby. This is for the boy. This is for the baby boy, right?
I mean, I think he would have been happy with anything. We
Okay.
didn't know
Okay.
the gender,
Okay.
because this was,
So what
I
was
think,
keeping you guys going for the third was not necessarily the vision of this baby boy. It was just a third child. Okay.
a third child.
Okay.
Yeah. I mean, I think if he could have had his pick, he would have chosen a boy,
Mm-hmm.
but he, just because, he would have liked to have had one of each,
Mm-hmm.
but, it wasn't mandatory. And then, yeah. And so we, I broke out on like the worst hives. And then I started to get angioedema,
Oh
which is
no.
when like your head swells.
Well, not
And
just
so
your
I
head.
went
I mean, your face, your lips, the back of your throat can
everything.
swell down here, this area called the
Yeah.
epiglottis that essentially is right over your windpipe. Imagine having your windpipe, this thing that's sitting on top of it. And the thing
Blocking.
that's sitting on top of it is swelling and getting huge. It's an ER doctor's nightmare because without oxygen, organs just start dying one by one by one. The first one to go is your brain. And so if the thing that is literally sitting on top of your airway like a valve is swelling, I mean, that is extremely life threatening. So you get angioedema as this reaction. And
Yeah. So,
what are you reacting to? Did they find out?
well, now my allergist thinks that they're idiopathic hives caused by stress
Oh, wow.
because I've been tested for like everything, and they had thought maybe it was the exogenous progesterone, but that doesn't make any sense because I
Mm.
have taken it before.
And technically, it's anaphylaxis, by the
And
way, for people watching. If it's an allergic reaction, it's anaphylaxis.
so I went to my fertility doctor. I'm like, what do I do? And they're like, go to the ER. Like, what are you doing here?
Yeah.
And
Oh, so
so
you
I
showed
went to
up
the
at their
ER.
office with like a swollen
Yeah, they're
face. You're
like,
like, help.
yeah, yeah. And they're like, we can't help you. Like, and I was like, I'm not going to the ER. I remember my best friend had taken me, my best friend, Sarah. She's like, um, I'm like, I'm not going to the ER because I have like so much PTSD from
Right.
like the ectopic
Oh, yeah, yeah,
rupture
yeah, yeah, yeah.
and like the horrible experience that I had had there. So it's funny talking to you, who I love and admire, because I really have like bad associations with the ER.
Mm,
And she's like, you're going to the ER, like you're like you don't have a choice.
mm.
And so I get there, and they admit me immediately.
Yeah.
Put me on
You were the
IV
scariest patient of the
steroids.
day, by the way. Being an
Oh,
ER
really?
doctor, you were the scariest patient of the day. Because again,
Yeah,
if
it's
you
a lot
can't
of
get
fun.
oxygen, that's that. We can fix so many other things, but it is so time sensitive if somebody's airway is occluded. So they saw you and they were like, "Oh!" They were terrified by you.
Yeah, yeah. They were like, yeah, but it was wild. Like I remember the night before my head had started swelling. Um, it was the worst night of my life. I was so itchy, like that I can't even explain to you. I think I took like 8 Benadryl.
Mm,
It didn't matter. Like the hives were so like it was wild.
mm.
They were raging. It was by far I was like suicidal. I
Oh yeah.
wanted to kill
Yeah,
myself
you're just
because I
like,
could
rip
not
my
be in
skin
my
off.
body.
Can you just take my
Yeah,
skin off? Oof.
it was horrible.
But you
Like I
wouldn't
was
go, but
literally
you
like,
didn't
I'm
want
just
to get
gonna,
seen because of your experiences in the past. You're like, I'm going to do
right.
everything I can to not go to the emergency department.
Yeah. And I remember Ira
Can
was
I be
like,
your ER
your
doctor
head
next
is
time?
only,
Can I take care of you?
please.
We'll make it a
Yeah.
much better experience.
Ira was like, your head is just swelling because you have been itching. And so it's like all the histamine building
Yeah,
up in
yeah.
your body. And I'm like, okay, well, like, what do I do? He's like, stop itching. I'm like, I can't. Um, you
Doesn't
know,
work like that.
and yeah, it was awful. So they gave
Uh,
me like Ativan, they gave me
sure.
like all this stuff in the ER. I ended up being there for 3 days.
Oh my God.
Because it was like they couldn't get it under control.
Mm.
Um, and while I was in the hospital, they told me that the HCG started dropping, like that I was no longer pregnant or like it wasn't a viable pregnancy. And I remember I was just like, I couldn't even think about anything else because my body was like on fire. And I was just like, okay, like, enough, enough. Ira was in a case. And so when he got out and heard that I was in the hospital, he came and he was just, I've never seen him like this. He just like hysterical crying, like
Oh.
collapsed on top of me
Oh.
because he felt like him asking me to do this had like put my life in danger
Mm.
again.
And did he feel like he was
You know,
brushing you off the night before?
I think so, and I think you doctors tend to do that
Well,
sometimes.
yeah, it's true. It's true because there's so
You're
many
being
little,
dramatic.
well, there are so many little things that do just take care of themselves. Like the more you're in medicine, the more you realize that there are a lot of things you don't have to intervene on, but we get it wrong every now and then. And when it's a loved one, that's devastating. And so for him to be like, nah, you're good, just stop bitching it. And then you have to get admitted for 3 days and then maybe you're losing. I mean, there obviously what you're going through is extremely traumatic, but he's going through, some trauma of his own.
Yeah, and I'm a healthy person. I'd never been hospitalized in my life, and all of a sudden, in like a year,
Mm,
the span of a year, I was hospitalized twice. I had to have surgery, for trying to get pregnant. Like,
right.
so that was just like a very sobering situation because I had done this to myself. This was a choice.
Mm,
And we had chosen this path that had led me to such trauma, and it was horrible. Yeah, so I had stopped. I remember the fertility doctor came in and he was like, you should just keep taking the progesterone. Like there's a 1% chance that the pregnancy may turn around. And I was like, nope, not doing
you're
that.
like, I'm
Like if there was
done. I'm
any
done
chance,
here.
yeah, I was done. Like done.
Mm,
And Ira even said he's like, you're done. Like we're done. Um and then I had to go when I got out of the hospital a couple days later for a follow up to see. They wanted to make sure that the pregnancy wasn't ectopic. Fun because the HCG had been erratic. Like it had
mm.
gone up, it had gone down, and so that's like a sign of an ectopic. Because if
And
if it's
again,
not
when
a
you've had
viable
ectopics before, you're at increased risk for ectopics again.
yeah, and so I was like, okay, I just hope that like this takes care of itself, that it's not another ectopic. I don't want to deal with that at this point. And I went back and like the HCG had gone up. So I was like, great, good. Like now it's probably an ectopic because
Mm,
if it was a miscarriage, it would be going the
dropping.
other
Hmm.
way. Yeah. And it was rising. It had like tripled from the previous um, testing. So it had gone up like significantly. Um, but they still like weren't hopeful that it would be viable, especially because of the situation with they just didn't think it like I was in a healthy state. I don't
Mm.
know. And so they were just I don't know. They were like I remember I like went out and drank. Like I thought I was not pregnant. Like they had made me feel like there was
That
no
that's
chance
it.
this was a
Yeah.
viable
Uh-huh.
pregnancy. I was like drinking my sorrows away. Like we
Right.
went out to dinner, I had tequila. Like I never
Right.
thought that this was a possibility.
Which you would have
And
never
then
done had you known there was a
I would
perfectly healthy
never,
growing baby in there. Right.
never, no. And then, yeah, and then they, a couple days later, it had gone up more. And I guess like I remember the being on the phone with the nurse, and she was giving me the results, and she's like, "Yeah, Dr. Chantilla says that it's a 95% chance that this isn't viable." And I'm like, "Wait a minute, like there's a 5% chance that this is viable? Like what?" I'm like, "I had tequila last night." Like I I was shocked. Like I didn't think that that was like a possibility at all. And I remember like feeling like, wow, like I had sort of already like mourned and grieved like my fertility, like the idea of a third child. And so hearing that there was even a 5% chance that I could have a baby, I was like, what? And I remember that night was Friday night. So I light Shabbat candles
Mm.
and every Friday night. And
Mm.
so I was like, I'm gonna light an extra candle. Like
So
so
explain that to me.
yeah,
So do you
so
light a candle for each one of your friends and family members, or are you lighting these candles based off of like hopes and desires, or how does this work?
so most people will light at least two candles to bring in Shabbat at sundown on Friday night, our day of rest. A lot of people have the tradition that they light one for each family member. So that's what I do. I light one for each of my kids and my husband. Um, but for some reason on this night that I had just gotten the call that there was this 5% chance that I may
Mm.
be still pregnant, I was like, I'm gonna light an extra candle. I was like, I just want to show God that like I'm hanging on to whatever hope there is. Like
You're in it.
if it's just the tiniest window, it was the first time in my whole journey of infertility and pregnancy loss that I was like, I'm gonna invite God in,
Yeah, you're showing God that you
you
truly want
know?
this.
Yeah,
Like if you can
yeah,
give this to me, this is truly what I want.
yeah. And I was like, I really, and I was just like, I let go. I didn't, there was like this serenity I had um with it. I it was the first time in my whole experience that I stopped fighting up against something. And I
Mm.
was just like, okay, like they're telling me 5%, like I'm doing everything I can. I'm gonna light this candle and like, if it's meant to happen, it will.
That's beautiful.
Um, and I sort of like believed it. It was weird. And Ira and I actually discussed it later, and he sort of had the same feeling, but we didn't talk about it because it was it was just too much to really like digest, too
Mm.
much, too emotional.
Mm.
Um,
Did he see you light the candle, and did he know what that candle symbolized?
no,
Mm.
no, we only talked about it later, and I think I may have told him the next day, like, yeah, I actually lit a candle last night. Um,
Mm.
and um, yeah, it was really like for me, like opening up the vessel to receive the blessing, I guess, like that action, like putting an action out into the
Mm-hmm.
universe,
And you did
which I
receive the
hadn't done.
blessing.
And yeah, that was the crazy thing. The story has such a happy ending, um, which it didn't for so long.
Right.
And I got, not only did I get my third baby, but he was like this miracle baby that like
Mm.
was
Yeah.
never supposed to be.
Uh-huh.
Like I had stopped taking the progesterone, I had gone through the hives, I had drank tequila, like I had done like all the like nothing was going in the right direction. And yet like I produced this like perfectly healthy, like incredible child, and not only that, it was a boy,
Mm.
which like to then have like we had two daughters, to then have like a son was like just like really rounded off our family in such a
Yeah.
perfect way. And like for Ira, it was so special because he actually like trained with a rabbi to do the bris, so that because he's a surgeon, he wanted to do it
Oh,
himself. And they say that like it in the Torah, they say that like it's the highest honor is to like do your own son.
wow.
Most dads would never do it
Right,
in a
right,
million
right.
years. I don't think most moms would let them,
Yeah.
but
Yeah. They asked me if I
and
wanted to deliver
Ira
my own baby. I was like, no, I don't want to do that.
good.
Yeah.
Yeah, and he Ollie, the pregnancy was not the easiest by any means.
Mm.
There were a lot of complications. I was bleeding throughout the first trimester. Like every step of the way was like
Everything you've
complicated
been
and
through.
traumatic, and like we never got like a normal report. And like
Mm.
he ended up being growth restricted. I had to like go to um high risk, like, and then I had placenta previa,
Oh
and
my
my
gosh.
I'm sorry, like my placenta ruptured, and so I was bleeding out.
You had
I
placental
drove myself to
abruption
the
as well?
yes,
Oh my
yeah, my
gosh.
yeah, and so I drove myself to the hospital because I was bleeding out. Um, you know, it was horrible. I thought, and like at that point, I thought I was losing the baby. Um, I pulled up to Medical City and like I just left my
And
car, like
you could lose the
running,
baby with
and
placental abruption.
I'm lucky I live very close to the hospital.
Mm.
Um, and like I got there and my water had broke. That's how I knew that about the placenta abruption because there was blood
Mm.
everywhere.
Mm.
And so I ended up having the baby like 30 minutes after I got to the hospital.
Wow.
Yeah, and
Was this an emergency
it was
C-section that they did?
I did not. So they let me have. Well, I was having contractions,
Wow.
and
Okay.
I was progressing, and they let me deliver. They told me the actually the doctor said it wasn't my doctor. It was whoever was on call because
Mm-hmm.
everything had happened really fast. Um, and she was like, "I we can't wait for a contraction, but I'm gonna give you one chance to push."
Mm.
Um,
And you're like, that's all I
and
need, baby. Let's go.
yeah, it like he honestly like this is so great. He like fell out like it was the easiest birth. He was like 4 pounds and like I pushed and he was out and like it was and he was like screaming and it was like thank God, you know, like
uh,
but yeah, when I got to the hospital and I was able to get the epidural like immediately. They took such good care of me at Medical City. Like I got there, I was in the room with the epidural like within 5 minutes. They, you know, that it was like I guess they can't tell. Maybe you can speak to this, but they can't tell that the placenta ruptured until you actually deliver.
right.
They can
It's
only
very
assume that
it's
that's
very
what
difficult to
happened.
sometimes you can identify it on ultrasound, but yeah, you just have to basically put the pieces of the puzzle together. There are very few diagnoses that we can't just like do a CAT scan or do an ultrasound or do a lab test. There's some that are still, you know, in this day and age, a clinical diagnosis, and placental abruption is one of them.
Yeah, so they were only able to like reduce like they figured that that's what had happened because there was no more fluid and like just the
Right.
amount of
Right.
blood that was coming.
Gosh.
So
And so
yeah, it
baby
was
came
very
out
traumatic.
and baby was
Yeah, well,
immediately crying and obviously breathing and
yes,
doing fine. I
yeah.
mean,
Had to go yeah, totally, thank God. Breathing, crying, had to go to the NICU just because he was early and so small. And like had what they I guess affectionately refer to as wimpy white boy syndrome. Um, so
this is a thing. I
he
didn't know about this.
apparently in the NICU, that's like how they refer to it as if it's like a medical term.
Wimpy white boy
Apparently the
syndrome.
white males, apparently the Caucasian males are like the worst.
Oh my gosh,
That they
that's so
all
funny.
have like low blood sugar. They don't eat well. They're just like kind of
And
lazy.
you're like, come on,
And
get your stuff together. Pack it
yeah,
up, get a
yeah,
job, move out of the house, wimpy white boy.
exactly.
You're 2 days
So
old
yeah,
now.
and I mean, he's still a wimpy white boy. He like is
uh,
16 months old and is still not walking.
16
Um,
months old now. And what's his name?
Ollie, Oliver
Ollie.
Strong. His middle name is Strong,
Oliver
but
Strong. I love that.
yeah.
I love
So we
that.
yeah, but he's perfect. He was in the NICU for a couple weeks, mostly just because he wouldn't eat enough and his bilirubin,
Mm,
which is nothing life-threatening, thank goodness.
right,
But
right,
there's nothing like being in the NICU with a healthy baby to make you just count your blessings.
right. And seeing the
Um,
other babies that are, I mean, literally the size of the palm of, your hand. You're like, thank God we
oh
made it
yeah.
as far as we did.
Yeah, and I didn't, I'd spent a lot of time over the years leading up to that feeling sorry for myself, feeling like the
Mm,
victim, and like being in the NICU with Ollie after everything I had been through. I was like, I am blessed. Like I
mm.
am so blessed. Like I have no room
You
to
are
feel
blessed. You
down
are
or to
blessed,
feel
Lizzie,
sorry
but
for
you
myself.
fought for that blessing. You
I
fought for
did,
that. I mean,
yeah.
I'm emotional now, just having gone on this, this journey with you for just, an hour or so here. But you experienced that journey for years and years. And you have, you have so much strength and determination to be able to push yourself through those moments, those low points. Again, I mean, and it's not just emotional low points. These are life-threatening experiences that you had. And you were
Yeah.
able to get through it. And you ended up with this happy story at the end of the day. You have these 3
Yeah.
beautiful, happy, healthy children. So
Yeah.
let's,
I do think it's important to, like, touch on the fact that even when you do get your miracle, the trauma doesn't go away. And
and it's still with you.
I do want to bring awareness to that, because, like, I really struggled trying to escape the pain and the emotional turmoil that I was caused, and then feeling like, oh, I have this healthy baby now. Now everything should be perfect, and it's not.
People want to put a little bow on it like I just did. Like, oh, and now it's a happy story and that's it. Like,
And
no, actually, that trauma is still within me and will always
it is,
be.
but you still,
Mm,
you still live with it, and it's part of your story, and
mm-hmm.
you still have to cope with it, and it's a part of you, and
Right.
um, it's a part of the journey that got you to that place. But yeah, like, I had 3 life-threatening experiences
Mm-hmm.
leading up to his birth. The ectopic rupture, the angioedema, and then the
And the placental
placenta
abruption.
abruption.
God.
So, it was a lot for one person to go through in a short amount of time. Um, and I'm still dealing with the aftermath of it,
Mm,
in some ways, with anxiety, and um, so I want to normalize that too. I think
mm.
it's something that we should talk about more.
Well, I think that's so important. So, Lizzy, knowing that there are people watching right now that have either experienced infertility, ectopic, miscarriage, or placental abruption, or all of them, is there anything that you want to share with them in particular? Is there any like advice that you want to give them as they are going through these emotions, either they're fresh or they're old traumas that, like we talked about, are not going away?
The first thing that I want to tell anyone who's going through a struggle with infertility or pregnancy loss or anything in between is that you're not alone. That so many women are going through the same thing that you are in this very moment, and this struggle is not uncommon. And um, you have a support system out there, a sisterhood, a sorority that we never wanted to join or be a part of, but we are, and we're all here to lift each other up in that. Um, and I think if I had known that, that would have been very comforting to me, and so that's what I would want somebody to know. I would also say that the thing that the thing that really made it all easier for me at the end, and I wish that I had incorporated it more in the beginning of my journey, was having faith. And I know that God can be a very triggering word for
Mm-hmm.
people, but I think that most of us out there can agree that there's a higher power, whatever the higher power of your understanding is, whoever put us here on this earth, created this universe, you know, we can only control so much. And it can be so exhausting to feel like you're constantly in this fight against nature, against
Mm.
things that are just totally out of your control. We
Feeling
thought,
like
oh,
it's
we were
you
gonna
alone versus the world and all of
totally
these terrible
the world.
complications. And
Yeah, and even this is even with modern science, even, with IVF, God is still the one, the higher power is still the
mm,
one in charge. The doctors and the scientists can only control so much. Um, but at the end of the day, it's the woman's body that's going to either, to either have a successful pregnancy or not. And so, knowing that you are not in this alone, that there's a higher power in it with you, and just handing over the fight, because it's exhausting. And I
well, I
think
love
that
that the
it
moment
really
the
helped
moment
me.
that you did hand over the fight, the moment that you lit that candle was the very moment that things started moving finally in the right direction with your little
Yeah.
boy Ollie.
Yes, and the wild thing is after Ollie was born, now I started getting my period regularly, and it turns out now my body is working.
You're like,
Um
now?
yeah, and and a lot of it they say that one of the big theories about hypothalamic amenorrhea is that it's caused by stress.
Mm,
And my hives were a manifestation of stress.
mm,
And so, my body was reacting to this toxic environment that I was not that I was indirectly, causing because of
mm.
my stress level. And so, it's really wild to me how the mind and body are so connected
So interconnected.
and
And there's so many
so
diagnoses out
connected.
there that we don't really understand medically. There's like this one condition called fibromyalgia where people, more commonly women, have pain in all these different areas of their body. We can't explain it. Everybody wants to write it off and be like, they're crazy. But no, they're not crazy. These are physical manifestations, a lot of times, of emotional pain and emotional stress. And then there's the other arm of it where it's like maybe this is all explainable, through kind of issues with either the central or peripheral nervous system, and we just don't understand it yet, and that's okay too.
Yeah.
But there is an inextricable connection between the mind and the body. You know.
Absolutely. And, I think it's hard for people coming from a Western medicine background. I know for me and Ira, he was reluctant to, talk about integrated medicine or,
Yeah. Yeah.
acupuncture, any of these things.
Right.
But I've seen with my own body that when my
Mm-hmm.
stress level was reduced, my body responded. And
Mm-hmm.
so, like, I am living proof of that.
And now, if you guys
And
wanted a fourth, you might just be able to do it without in vitro fertilization. Now, is
I
that where
mean,
we're going? Are we
that would
going for
be
number
wild.
4?
I'm not trying actively to have
Mm.
a fourth child. I feel very much like I have my hands full, but
Mm. Are you trying to prevent a fourth pregnancy?
I'm not on any birth control. Yeah.
Interesting.
Um, I mean, I I preach all day long, you know, that my whole life's purpose is the future of the Jewish people. So like
Mm.
if I can
Mm.
add to the future of the Jewish people, like maybe, if that's my purpose, then I wouldn't want to close the door on that, I guess.
Right. Right.
Um, but I don't know. And I would be very much okay either way.
Mm. Lizzie, thank you so much. One, for being you. Two, for being so courageous with sharing your story. All of the intimate, painful, and embarrassing details of it, and I know that you're gonna inspire people and empower people with this story, and I could not have more respect for you for being able to share that today. So thank you so much.
J Mac, thank you so much for having me. It's such an honor, and I'm so glad that you're bringing awareness to this topic.
mm,
Really.
well, it's such an important one, and anytime, like you said, the minute that you mentioned your struggle, you started getting flooded with stories and support, etc. The same thing. Anytime I post anything about how common miscarriage or infertility is, the comments are flooded. So so many people out there are silently suffering, and to be able to help make them feel a little bit less alone, is a very beautiful thing, and I'm privileged to be a part of it. All right, everybody, if you want to continue to follow along with the daily, beautiful content that she's making with her kids, her amazing fashion sense, and her wonderful life that she's sharing with the world, where can they do that?
You can find me on Instagram at Lizzy with a Y, Lizzy, Savetsky, Savettsky. And I'm on TikTok at Elizabeth Savetsky.
This is Dr. J Mac. Thanks for sticking along with us. I know that was a little bit longer than our normal episodes, but what an important episode to do. Subscribe. Let's do this again sometime.